Hey everybody, Dr. Osgood here with Grassroots Functional Medicine. Thank you for your interest in our adaptation programs. I wanted to make a quick video reviewing our program and our processes and what you might expect if you become a patient at Grassroots, but also how we're a little bit different than what you might find in other conventional or alternative practices. So our programs, we have two different programs. One is the adaptation program, one is an adaptation plus program. Where you fit and what program is best to you will depend on your individual situation. The adaptation program is approximately 8 months long. It includes 6 visits with myself, 4 visits with a nutritionist. It also includes several other resources. And then our Plus program is a 12-month program, and it includes 10 visits with myself or another practitioner. It includes, I think, 6 visits with the nutritionist, and it also includes mindset mastery consults with our health coach. And that's really important because some people really need that mental, emotional support, and that can be a huge piece to recovery when you're dealing with chronic illness. And we found that to be a game changer with people with more complicated illnesses, whether that's mold or mycotoxins, Lyme disease, tick-borne illness, real complex autoimmune disease, or PANS and PANDAS in the pediatric population. So if you have a more complex disease process that is going to require more attention and more time, that's where the Plus is a better option. But we'll discuss that at the discovery call and figure out what's the next best step for you. We also have a graduate program for people who complete both the adaptation or the adaptation plus program, because we don't want this to just be done when you're finished with the program. We really want to see your care through to the very end. So the process actually starts with a pre-appointment health assessment. So this is a discovery call where you will just you will set this up online on our website, and the discovery call is just a quick 10 to 15 minute talk with myself. The point of that call is really just to review where you're at, what's going on, what your goals are, and to make sure you're a good fit for our program. My mission is not to get as many patients as I can, but to help as many people as I can. And I realize that we can't help everybody, and not everybody is going to benefit from this process. So we want to make sure you are in a good place mentally and physically to make the changes that are necessary for us to help you and get you well. So in this discovery call, if at the end I say I don't think this is the right fit for you, or you're not at the right point, don't take offense to that. I really am trying to help as many people as we can, and we want to make sure you're successful. And sometimes people need a little bit more time, or sometimes they're not willing to make the changes that we know to help people get well. So we're not for everybody. I'm fully transparent about that. And that's why we do these calls, and they're completely free. I just want to make sure that we're going to be able to help you get the results you're looking for. So if you do decide to become a patient, you call the clinic, you set up your first appointment. We'll have you fill out a comprehensive set of intake forms, and then you will schedule your first consult with me, which is an 80-minute consult. And that is where we really go through your entire health history. We create a timeline from the moment you come into the world to the moment you're in the office. And what we're trying to do is see, how your immune system has developed. We talk about things as crazy as, how you were born. Were you a C-section? Were you a vaginal delivery? Were you bottle fed? Did you have a lot of antibiotics? Were there significant stressors in life? Did you have any trauma? Did you have hospitalizations? What medications did you take? All of these little details may sound insignificant, but really they play a big role at painting that picture of when did things change, what was going on when things changed, and how are we going to put these pieces together to get you to that state of wellness that you deserve. The timeline is super important because that's going to help us determine what testing is going to be best. So the comprehensive testing is absolutely essential. Everybody gets different testing. It's not a cookie cutter approach, but the testing gives us clarity on what is going on. And so many people just get such a relief because they've been struggling for years and years. They've been told that, it's part of aging, that they're making it up, that, this is just what they have to live with. And the comprehensive testing gives them confirmation that something is truly imbalanced. And that's what I love about it. We may look at stool, we may look at urine, we may look at blood work. There's a variety of tests we may do depending on what's going on to help us figure out what are the next best steps, because I am not a big fan of guessing. Guessing takes away time from you getting well. So we really want you to get it well as soon as possible, and the testing plays a big role with that. And then we'll also discuss a foundational nutrition plan to start off with that is really focused on reducing inflammation and optimizing detoxification so you can feel better quicker. If you're not willing to change your diet, you're probably not a good fit for our program, because no matter what you're dealing with, we have to be fueling our body with the right nutrition. And the nutrition appointment will, again, just solidify that and give you more techniques and more strategies to be successful. The nutrition consult is about an hour long. That's usually completed about a week or two after your first visit with me. That's where the nutritionist goes into all the nitty-gritty details and gives you lots of resources to be successful. We give you meal plans, we give you recipes, we give you multiple things to help you on the fast track of getting well. Because what I have found in my experience is that people need resources, they need accountability, and they need different perspective, which is why we have built a team to get you well. This is not a cowboy show where it's all just me. We're supporting you from multiple angles and utilizing whatever resources we need to get you to that end point the fastest. Next stage in the process is what we call the evaluate and take action. This kind of begins with the second follow-up with me, because what we're doing in that second follow-up is we're reviewing the findings from that initial comprehensive set of labs and devising a personalized treatment plan that is going to help you get some relief and improve your symptoms. Part of this as well is accountability. Again, you're going to be following up with somebody pretty frequently in the beginning, because we want to make sure that you are staying on track. We encourage you to communicate with us. We don't want you to feel like you're burdening us with your questions, because we want you to be successful. And again, we want you to make sure there is no confusion along the way. Part of the review of findings in that second visit with myself is I'm going to actually make a video for you that reviews all of your labs ahead of time. So before our visit, you can see what's going on with those test results and have an understanding of where things are at. My job is to educate you on what is wrong and what needs to be corrected. So you need to have a good understanding of what we're looking at there. And the video has been a great resource for people to watch ahead of time and even after the visit, just to put all of the pieces together. In that visit, we're putting all of the pieces of the puzzle together so we can figure out what are going to be the next best steps. And we are focusing on the foundational 5, I call them. We're looking at your food and nutrition, and again, making sure you're fueling your body with what is appropriate and you're removing the things that are inflammatory. We're focusing on sleep. We're focusing on relaxation. We're focusing on movement. We're focusing on detoxification. We're focusing on mindset. All of these factors make a huge difference in the outcome. And if we're missing things, if we're leaving things out, you're going to be stuck struggling. The next stage of the process is the reevaluate and optimize stage. So what this is, your bodies are constantly changing. We need to reevaluate what those initial treatments did and where we need to go from there. It's about peeling away layers of the onion. And sometimes in that initial phase, we're peeling away 1 or 2 layers and then another layer pops up. So this is not a sprint. We don't want to think of this process, no matter what you're dealing with, as a sprint. This is more of a marathon. Sometimes people get better in 3 months. Sometimes they take a couple of years. It all depends on how complex the case is. But we want to make sure we're continuously moving forward and continuously evaluating your progress to see where we need to go and how we're going to get you better. So the progress tracking, the follow-up testing, that is all essential. When we implement a treatment protocol, we want to make sure it worked. And again, taking that guesswork out of it. And we want to future-proof your health. And what that means is that, after the program is done, the process isn't over. We actually encourage you to continue. We have an adaptation graduate program that is more of an annual program. We want to keep our fingers on all of the hard work you've done keep you motivated, and hold you accountable so you don't fall back into the slump that you were in before that was leading to your issues. Health is something we need to continually strive towards. It's not a one and done phenomenon. So our program is set up not only to give you clarity, not only to relieve your symptoms, not only to get you well, but also to keep you well in the years to come. That's what it's all about. So I hope you found this helpful. Again, these are our adaptation programs at Grassroots Functional Medicine. If this is a process that you're interested in, if you're ready to make change, if you're ready to make your health a priority, if you're ready to get well and stay well, and you need a team to hold you accountable and give you direction and give you resources to be successful, that's what we're about. So the next step is to set up your free discovery call with me so we can, again, talk a little bit more about your case and figure out if this program is going to be right for you.